what are the benefits of heart healthy eating?
In India, every 33 seconds, one patient dies of heart attack. Medicine is not the only solution. The ideal solution is in your kitchen. Ideal solution is in your lifestyle.
Can you suggest any changes in dietary pattern so that it can be helped with managing hypertension?
Our diet has 2 to 3 times more sodium than what is recommended. Like biscuits. Most of us think that biscuits, obviously, sometimes the biscuits are sweet. How come it is a source of salt? The answer is even sweet biscuits also has salts. Gujia, chanachur, and achar, papad. So all those forms a hidden source of sodium in our diet. To avoid all those foodstuffs which are loaded with sodium.
What sort of fats one should consume and what sort of fat one should avoid consuming?
People usually think the fats are bad, universally it is bad. Actually it is not so. Not all the fats are created equal. There are some fats which are essential. That means if you do not get in your diet, you will have deficiencies. Biscuits or cookies or cakes or pastries which are loaded with trans fat. Deep frying causes fat to convert into trans fat. Trans fat you need to avoid altogether. But what about minimizing? You can take saturated fat, you can take ghee and butter, but your quantity should be in moderation to incorporate nuts and seeds in your diet.
Hello dear listeners and welcome to Heart Talks, where we bring to you our most insightful and meaningful conversations about our heart health and well-being. Today, we shall be discussing about a topic that is very daunting to most of us, which is hypertension, also regarded as a silent killer. We shall further proceed into discussing about the dietary procedures and protocols that is required in hypertension, followed by the do's and don'ts. I am your host Palikanta Sinha, and today I am having the utmost pleasure to have in conversation with us one of our most regarded and renowned cardiologist, Dr. Arub Deb. So let us begin with our first question. Sir, could you please tell our listeners that what are the benefits of heart healthy eating?
Yeah, that's a nice question. In India, every 33 seconds, one patient dies of heart attack. So it's a major problem in today's world, especially for a country like ours. And most of the people, they tend to think that what is the solution for this heart attack? How do I prevent that? Many people, they are of the idea that medicine is the solution. But medicine is not the only solution. Then what is the solution? Whether the solution is in the supplements, or whether the solution is in hospital, or solution is in the doctor's chamber. The ideal solution is none of them. The ideal solution is in your kitchen. Ideal solution is in your lifestyle. Because there had been various studies, including one of the recent studies in 2023. It was done by Indian Heart Journal, where they have shown if you follow a proper dietary guidelines, take a proper diet as well as have normal lifestyles, you can reduce the heart attack risk by 30%, more than any medicine could give you a benefit. So, all in all, to prevent heart disease and to prevent heart attack, more than the medicine, it's your lifestyle as well as what you take that is more important.
So with that, can you suggest any changes in dietary pattern so that it can be helped with managing hypertension?
Hypertension is also one of the main reasons behind early onset heart attack as well as other complications like kidney failure, stroke and other complications. So that's why managing hypertension is very important, especially in Indian context, where most of the people that are not diagnosed with hypertension on time, they do not get their hypertension treated adequately because of financial conditions or some other socio-economic conditions. So that's why dietary management forms the cornerstone of therapy as far as hypertension is concerned. Our diet actually is loaded with sodium. WHO or World Health Organization recommends the total intake of sodium should be less than 5 gram. That is around approximately 1 teaspoon. But our diet has much more than that recommended amount. Our diet has 2 to 3 times more sodium than what is recommended. Why? Because we not only take salt but also take foodstuffs which are loaded with salt, which are hidden salts in our foodstuffs. So you might ask, what are those foods which are actually rich source of sodium, so that we need to restrict those foods? So those foods are actually the foods which we take on day-to-day basis, like biscuits. Most of us think that biscuits, obviously it is, sometimes the biscuits are sweet. How come it is a source of salt? The answer is, even sweet biscuits also has salts. Leave aside the salty biscuits. So biscuit is one of the source of salt. Then comes your other namkeens, bhujia, chanachur, and achar, papad, noodles, tomato sauce. So all those forms a hidden source of sodium in our diet. And especially in a region like ours, in the eastern region, people take lots of, and as well as the coastal region, people take lots of salted dried fish, which also is one of the main reason behind the sodium overload that we are seeing on a day-to-day basis in common people. So in order to reduce your sodium intake, you need to not only cut down your intake of common table salt, but also to avoid all those foodstuffs which are loaded with sodium. Because sodium basically does what? Sodium basically helps in the absorption of water in the kidneys, and thereby it raises the blood pressure. So it not only raises the blood pressure, excessive amount of sodium also puts an undue stress on our heart as well as kidneys. So our diet should be moderate in sodium, less than 5 gram per day, which WHO has set the standard for. And on the other hand, our diet actually is less in potassium and magnesium. So these two substances, sodium and potassium and magnesium, they are actually opposite. Potassium and magnesium acts opposite to sodium. So our diet is rich in sodium and poor in potassium and magnesium. And potassium and magnesium, what it does is that potassium and magnesium helps in relaxing the blood vessel, and thereby they improve the blood pressure as well as they improve the condition of the blood vessels as well. And potassium and magnesium also improves the electrical signal of the heart. So irregular heartbeat and other cardiac arrest comes down significantly if our diet is rich in potassium and magnesium. But unfortunately, in today's world, because the fast food culture and processed food, our diet is poor in potassium and magnesium. So you would ask me that what diets do I need to follow to increase my potassium and magnesium in the diet? The answer to that question would be to take lots of fruits and vegetables, because fruits and vegetables are rich source of potassium and magnesium. Any fruits and vegetables which are locally available, it could be banana, it could be any other source of fruits, any other locally available green leafy vegetables, they are rich sources of potassium and magnesium. So if you incorporate those fruits and vegetables along with various nuts and seeds, then nuts and seeds are also very rich source of potassium and magnesium. So what will happen is that your potassium and magnesium level will get replenished and your blood pressure will get controlled. Not only your blood pressure will get controlled, but your heart condition also will improve significantly if you do this dietary modification.
Sir, then to keep oneself heart healthy, what sort of fats one should consume and what sort of fat one should avoid consuming?
That's a good question. Once again, fats are a bit controversial. People usually think the fats are bad. Universally, it's bad. Actually, it's not so. Not all the fats are created equal. There are fats which are required. There are some fats which are essential. That means if you do not get in your diet, you will have deficiencies and you will have some diseases. At the other hand, there are some fats which are bad for your health, which you need to avoid. So next question comes, which are the bad fats? So bad fats are predominantly something known as trans fat, and trans fats are absolutely bad for your health, because trans fats not only damages your blood vessel, thereby they predispose to development of heart disease and heart attack, but trans fat can lead on to various other ailments also, like cancer and other chronic diseases. So trans fats needs to be avoided at any cost. Now you'd ask me the next question, what is the source of trans fat, isn't it? So trans fat, once again, it's most of the time is ubiquitously found in sources like your bakery items. Very commonly consume bakery items, like we take biscuits or cookies or cakes or pastries which are loaded with trans fat. Any bakery items. Next, your fried items. Whenever you fry, especially deep frying causes fat to convert into trans fat. So you should avoid deep fried food as much as possible. Restaurant foods, because restaurant foods are not only deep fried, but also they fry the same substance on the same oil. So that is something which is absolutely detrimental to the health. If you are using any oil and if you are repeatedly heating it, it leads to the generation of trans fat. So avoid, even if you are taking food at home, do not reuse or reheat the oil. That's a common problem we usually see in our household. In order to save some money, our mothers or sisters, what they do is that the same oil they use repeatedly. That is something which is very, very bad for your heart and for your health. So use fresh oil. Do not reheat the oil. Do not heat the oil excessively. Avoid using vanaspati like dalda, because this is also a source of trans fat. And try to minimize, if not possible try to minimize taking food from outside, especially restaurant food, because restaurant foods, they use bad oil. Not only bad oil, they use the same oil time and again. Restaurant foods as well as street side foods, because most of us nowadays are fond of street side food and restaurant food because they are crunchy, they are tasty. They might be crunchy and tasty, but they are absolutely not good for your health. So these are the sources of trans fat. In conclusion, in a nutshell, bakery items as well as in dalda or vanaspati, as well as reheating of the oil, fried foods, these are rich sources of trans fat. Next fat which you need to minimize, not totally avoid. Trans fat you need to avoid altogether. But what about minimizing? You should minimize saturated fat. Saturated fat like ghee, butter, all these are sources of saturated fat. So there is a controversy regarding saturated fat also, but all in all, you can take saturated fat, you can take ghee and butter, but your quantity should be in moderation. 1-2 teaspoon at the max you can take per day if you are hale and hearty. If you are having some heart disease, then it can be reduced to half a teaspoon per day. So these are the two fats we need to, trans fat needs to be avoided and saturated fat needs to be moderated. Now next question comes, which are the good fats, isn't it? Good fats are predominantly your monounsaturated fat and polyunsaturated fat. These are scientific terms, but to tell in a layman's language, what are the sources of monounsaturated fat and polyunsaturated fat? Especially various nuts and seeds. It could be any nuts and seeds like your almond or your walnuts, various types of nuts, or it could be seeds like pumpkin seeds, chia seed, various sunflower seed, various type of seeds. So nuts and seeds are a good source of monounsaturated fat. Then your mustard oil is a source of monounsaturated fat. Olive oil is a source of monounsaturated fats. So you need to incorporate nuts and seeds in your diet, which most of the time we do not take that amount of nuts and seeds in our diet. So nuts and seeds is very good, and along with that you can take, rather than taking a refined oil, you should go for and non-refined kachi ghani mustard oil. So these are the good source of, healthy source of fats.
So sir, my next question would be, nowadays we see the consumption of alcohol is a very common practice, especially in official setting or sometimes family occasions, and even there are people who regularly consume alcohol. How the consumption of alcohol as a whole affects the blood pressure issue, and what are the safe consumption limit of alcohol?
Alcohol is also once again a substance which people usually cannot moderate most of the time. They consume, they say I'm a social drinker, I take in moderation, but most of them cannot moderate that intake. And if they cannot moderate that intake, it can lead on to elevation of the blood pressure. Not only elevation of blood pressure, it can sometimes lead on to irregularity of the heartbeat, because those who are taking alcohol on the regular basis, they're magnesium deficient, and magnesium deficiency can lead on to irregularity of the heartbeat. So that's why alcohol as such needs to be avoided. That's what would I say, because I do not consume alcohol. Even if you want to, you cannot avoid it altogether. You can moderate the amount, maybe once or twice in a week, that too, one drink, and amount should be moderated.
Yes. So, sir, this is the most common query. Can weight loss through diet alone help in reducing blood pressure?
Yeah, weight loss is once again a issue which is plaguing our society significantly. So weight loss can lead on to various comorbidities. Weight loss, like increase in the body weight itself, can lead on to various conditions like high blood pressure, high blood sugar, fatty liver, high uric acid. So losing weight is something which is very, very important. Nowadays, there are various ways you can lose weight, and lifestyle intervention or modification, dietary modification is the best form. Rather than going for a medicine or an injectable, you should always go for a natural way of reducing weight. That is through dietary modification as well as through lifestyle modification. And the research had shown that if you reduce your body weight around 10 to 20 kilos, it can reduce your blood pressure significantly. Up to 10 to 20 millimeter mercury, you can have a reduction of blood pressure. So just by reducing the body weight, it can take care of your blood pressure significantly.
So with this, we have come to the end point of our discussion on hypertension. Thank you, doctor. You have provided us with valuable insights on how to manage hypertension. I'm sure our listeners would be loving it very much, because they would find it very resonating personally, and they would find it practical as well. So everyone, stay healthy, stay informed, until we catch up with you later.